I'm Ruby. I'm an engagement officer at the Environment Centre, and I just started my role just as the last funding period for this project was coming to a close, but I'm super excited to be working on it now and get to know everyone and hear about all the fantastic work that's going on and conversations with colleagues and patients. Yeah, thank you very much for taking the time to meet with us today. Um, just to reiterate why we're back, because I think it was briefly covered in the invitation email. So our involvement as the Environment Centre has been extended thanks to Southampton City Council public health funding. From now on, we'll be working alongside Amber from the Council's air quality team to coordinate quarterly network meetings like this one. We'll continue our delivery of air quality training and briefings for new clinicians. We can support the network in whatever way is useful to increase awareness of air quality among your colleagues and patients. An example might be running some patient outreach stalls over Clean Air Day next June, things like that. We're also looking forward to helping progress some of the legacy framework actions, which we'll talk about more at the end of today's meeting. But first of all, I think Bee's ready to talk through today's agenda. I hand back over.
Yeah, brilliant. Thanks, Ruby. So I'll pass to Amber in a sec to cover some updates from Southampton City Council. I'm going to talk about supporting patients who are burning wood or solid fuel now that we have firmly entered the heating season. And then we'll have some time to hear some updates from clinicians and, as Ruby just said, talk about the legacy framework which we developed at the end of last project. So Amber, over to you. Hopefully you're able to.
Super, thanks, Bea. I'll just share my screen. Is that working?
Yeah, all good.
Great. So yeah, just to introduce myself, hopefully most of you know me already, but I work for Southampton City Council as an air quality officer. And I'm just going to take you through kind of a few updates from the council on what's been going on air quality wise. So hopefully a really nice pretty graph showing the improvements in air pollution we've seen in the city over the last few years. So this graph actually goes from 2013. You'll be aware that 2019, 2020 we saw COVID. That's why we saw the sudden dip in that graph of most of the pollution levels. But these are all of air quality management areas monitoring. So all the areas that have the worst nitrogen dioxide levels that are being monitored. These are the kind of key areas in the city we are looking at. So we've seen an improvement of around 35% of all air quality management areas from 2019 to 2024, which is really great. And all of them are under the UK limit. And because they are all now reaching kind of under the air quality limit, we are awaiting council approval. However, we are going to be revoking 6 air quality management areas. So you can see on this map, all of the air quality management areas with a cross on are the ones that will be going because they are meeting the legal limits and have been doing so for several years now, which is really excellent. So the ones that we're keeping, that number 5, the Millbrook, Redbridge area, number 7, which is Commercial Road by the theatre. We've got number 6 up by Winchester Road roundabout, and then number 1, which is Beavis Valley. But it's really positive news that 6 out of 10 of our air quality management areas will be going soon, hopefully, and likely that more will be revoked come next year. We are keeping air quality monitoring going throughout the city. So this is a public portal for the air quality sensors, the Zephyr sensors, and we will be having 10 live from start of December for 2 years, which is really great. So we're taking part in a project called Net4Cities, which are welcome to have a little research. It's a EU project, so we're in collaboration with lots of other cities across Europe. We've got the wood burning, so there will be a monitor moving to St Denis and also keeping one in Woolston. And then we've got some sensors around Northam with the upcoming Northam Rail Bridge infrastructure project. And finally, just a few other key updates because of us meeting all of those NO2 limits in the city, as I've been saying, we are now exiting the NO2 plan, which is excellent. It was a funding source from JACU or DEFRA to give us some money to implement measures that will help improve the NO2, and we've seen such improvements that actually we don't need to be part of that project anymore, so that is great. We've also got some smoke control area funding coming our way, so we are doing a billboard or bus stop campaign, kind of a physical banner going out in the areas of the smoke control area to alert people and make them more aware of that. With the air quality action plan that runs to 2028, we've actually either completed or still running a lot of the measures that we put in there as targets. So we're well on track for completing that air quality action plan. And I am putting together a plan for Clean Air Day 2026, hoping I can be more ambitious this year and do a bigger event. So watch this space and hopefully something to look forward to. Thank you, Bea. All done. I'll stop sharing.
Thank you so much, Amber.
There
Does anyone have any questions at this point? Any comments or anything to come in on? Robin.
Yeah, morning everyone. Thanks, Amber. No, brilliant to see some of the progress against the air quality action plan and the revoking some of those areas. Has there been any feedback from the members of the public to hear those have been revoked, that they're worried about? What does that mean to the City Council in terms of air quality as well? I was wondering if there's been any public feedback. Thanks.
Yeah, of course. We are not actually going out to the public until we've got that council approval. So we need to go to full council and clear it with them before we can go out to the public. But I agree, some people might worry, oh, the council is going to do less in terms of air quality because they're being revoked. But that's not the case. It is a good news story, just saying that we are getting better.
Brilliant. Thanks, Amber.
That's great. Thanks so much, all. In that case, I'll move on now to talking about domestic burning, which does feel very topical given the temperature plummet this week. So some of you will have already heard this before, but hopefully it's a useful recap with some new elements as well. So domestic burning is one of the largest sources of particulate matter, PM2.5 in the UK. PM2.5 is small enough to enter your bloodstream when inhaled, and from there can reach nearly every organ in the body. It can cause heart and lung disease, as well as increasing risk of diabetes, dementia. It's even been linked to mental health conditions like depression and anxiety. Research came out just in the last couple of weeks from Global Action Plan, Ricardo and Hertfordshire County Council, which showed that if people in the UK only burnt wood when no other heat source is available, we could avoid more than 1,500 deaths every year and save the NHS over 54 million in healthcare costs, which is nearly 1.5 million GP appointments each year. Out of the various ways that we have to heat our homes, burning wood or solid fuels is the most polluting. So this graphic demonstrates PM2.5 emissions from a gas boiler, electric heating and renewable heating like an air source heat pump in comparison to emissions from a burning wood or solid fuel. It's helpful to note the difference between burning wood in an open fire versus an eco stove, which is basically a modern, efficient closed stove. So if a vulnerable patient mentions that they burn wood or solid fuel in an open fireplace, they will be being exposed to significantly higher levels of PM2.5. That being said, a study by the University of Sheffield found that even homes with the newest eco-design wood burners are still 3 times more polluted than homes without. Each year, in January, Global Action Plan, who are previous project partners on this project, organise Clean Air Night, which is a sister campaign to Clean Air Day. Clean Air Night raises awareness specifically around wood burning. And these are 2 case studies which have just been released in advance of Clean Air Night 2026. So the first, Laura always used to burn wood, started to develop wheezing and had recurring chest infections. The second, Jack, as a child, him and his family would visit his grandfather. His chest felt worse after visits, but his brother, who had asthma, would always have significant attacks the evening or the night after the visits took place. These snapshots are completely in line with numerous conversations we've had with residents across Southampton, both as part of the wood burning awareness campaign that we do at Tech and as part of patient outreach for Clean Air Champions that we've done in the past. So that one, the second one there, really reminds me of a conversation I had over Clean Air Day in a surgery in Woolston in 2024, speaking to a mum whose son at the time was 17, 18, would always suffer from asthma symptoms after barbecue nights with his friends. She wasn't sure if she was going to be able to convince him to stop going, but she was glad to know that that might be the reason why, and was going to try her best to talk to him about it. If we're talking to someone who burns wood, there's sort of 3 categories of advice that we give. So if someone has an alternative heating source, like a gas boiler, we would encourage them to burn less where possible, and maybe frame it like saving their fire for special occasions can sort of help soften the blow if someone really enjoys burning wood or other solid fuel. If someone is reliant on a wood burner to stay warm, obviously it's really important that that person is able to heat their property. So there are some things that can be done which reduce the amount of pollutants produced. So burning cleaner fuels. The really important thing to note is basically there's the drier the fuel, the fewer the emissions, and the recommendation is burning fuel with a moisture content of less than 20%. So that could either be kiln dried, so you purchase it and you know it's ready to burn, or if you're foraging wood, you leave it to season to dry for usually 1 to 2 years, and you can use a moisture meter to check that it's down to that 20% threshold. The other sort of key type of advice is about burning better. So we've already seen that using efficient appliances like eco-design stoves reduces the amount of emissions. There are some properties in Southampton where people have both a open fireplace and a stove. So using the stove rather than the fireplace would reduce emissions within the property. Following safer user practices, so ensuring the stove is always burning at a hot enough temperature, never closing air vents completely, and having the appliance serviced and swept regularly. It's usually once or twice a year, depending on the type of fuel and how often it's burnt. I wanted to mention something we're doing in Woolston this year. So each year we try and raise awareness in general about wood burning across the whole of Southampton. We're working specifically in Woolston. We delivered a behavioural survey in October to 1,200 residents, basically asking them what they burn, how they burn, how often, etc. And over the course of winter, we'll be doing a lot of targeted work in the area. So via social media, posters in community spaces, ads on bus stops, work in local schools, community events, and getting letters out to all residents. And then that's going to be bookended by another survey in March. This is based on a similar project delivered in Dorset Council, which showed that as people received more information about wood burning and the impact on health, they changed their behaviour, and there was a really clear, significant decrease in particulate matter emissions alongside it. So that's really useful information to then demonstrate the importance of talking to patients and residents about this issue. Already, we've had some really fantastic findings just from the survey we did in October, which showed that nearly 1 in 3 households in Woolston who have a stove or a fireplace have received information from our campaign in previous years, and as a result have increased understanding of air quality's impact on health, and all but one of them now burn less or burn more safely, so do those different elements that I was talking about a minute ago. I wanted to mention this for two reasons. Firstly, we'd be grateful to know of any opportunities to reach patients in the SO19 area this winter. And secondly, we're just a bit astounded by the survey data so far. It demonstrates that any intervention with information about the health impacts of burning does have a result on the residents' behaviour. So if you can speak to patients who burn wood or solid fuel about the impact on health, it will change what they do at home. So put together this example conversation flowchart of how you might speak to a patient. So obviously an introductory question. Do you burn wood at home in a stove or fireplace? If yes, we'd recommend asking whether they have alternative ways to heat their property early on in the conversation, because then it can shape what comes next. So if they don't, if they are reliant on burning wood or solid fuel to stay warm, and they can't afford to, for example, replace a broken or faulty gas boiler, which would otherwise be an alternative heating system for them. That's why the Southampton's Healthy Homes service exists. So this is a programme delivered by ourselves at the Environment Centre, funded by Southampton City Council, which can give grant funding to install new heating systems that are always designed to be affordable for the person, for the household. So if someone is in that situation, they're reliant on wood burning because they can't afford to install a different, better heating system, there is support available for them, and you can refer them to Southampton Healthy Homes. It's probably worth mentioning, though, that I've talked quite a bit about people who are reliant on wood burning. Nationally, that's only 8% of people who burn wood. Locally, we know from our survey that's only 4% of people who burn wood. I'm not surprised by that decreased figure. The national data obviously takes into account rural areas. Our survey was just for people living within Southampton City. So in rural areas, people are more likely to be off gas. So for the 96% who do have alternative ways to heat their home, the next thing you could say is burning wood and other solid fuels releases air pollution, which can worsen your symptoms. Would it be possible to use your boiler or electric heaters more and burn less this winter? Obviously, if the answer is yes, that's great. And maybe worth a final reminder, burning less this winter will keep the air cleaner and protect your health. If the answer is no, so if, for example, the person is foraging for woods in local parklands, so able to effectively access that fuel for free, and that's the only way they can kind of maintain an adequate warmth within their home, within their budget. I mean, again, if they are struggling to stay warm due to income reasons, it could be a time to refer them to Southampton Healthy Homes. But if it's just a straight no, they don't want to stop burning, that might be the time to mention that there are other things that you can do to reduce the amount of air pollution produced, like burning dry wood, storing it in dry conditions, and having your appliance swept and serviced regularly. So hopefully this would only take about 30 seconds, but we know from the data that we've already got this year that just having this conversation will most likely change the patient's actions at home. They'll change what fuel they're burning, they'll burn less, they'll have their appliance service more regularly, all of which will decrease emissions and help protect their health.